A patient tells the nurse that he likes to drink kava herbal tea to help him relax. Which statement by the patient indicates that additional teaching about this herbal product is needed? A. I will not drink wine with the kava tea. B. If I notice my skin turning yellow, I will stop taking the tea. C. I will not take sleeping pills if I have this tea in the evening. D. I will be able to drive my car after drinking this tea. Answer. D. I will be able to drive my car after drinking this tea. Rationale. Patients should not drive after drinking this tea because it may cause sedation. Kava tea may cause skin discoloration with long-term use. In addition, it must not be taken with alcohol, barbiturates, and psychoactive drugs. What is the result of a potential drug interaction between benzodiazepines and rifampin? 1. Increased daytime sleepiness. 2. Prolonged benzodiazepine action. 3. Decreased benzodiazepine effects. 4. Increased central nervous system, CNS depression. Answer. 3. Decreased benzodiazepine effects. Rationale. When a benzodiazepine and rifampin are administered simultaneously, rifampin decreases the benzodiazepine's effect by increasing its metabolism. Daytime sleepiness is sometimes observed in elderly patients who are on benzodiazepine therapy. However, it is not an effect of a drug interaction between benzodiazepines and rifampin. Administering macrolide antibiotics or azole antifungals with benzodiazepines prolongs the effects of the benzodiazepines. Simultaneously administering CNS depressants and benzodiazepines promotes CNS depression. How is flamazanil administered when treating diazepam overdose? 1. 0.2 milligrams, 2 milliliters, intravenously, IV, over 30 seconds. 2. 0.5 milligrams, 5 milliliters, IV, over 30 seconds. 3. 0.2 milligrams, 2 milliliters, IV, over 15 seconds. 4. 0.2 milligrams, 2 milliliters, IV, over 60 seconds. Answer. 1. 0.2 milligrams, 2 milliliters, intravenously, IV, over 30 seconds. Rationale. Symptoms such as drowsiness and confusion after taking diazepam indicate drug overdose. The nurse should immediately administer 0.2 milligrams, 2 milliliters, IV flamazanil for 30 seconds, and then a maintenance dose of 0.3 milligrams, 3 milliliters, for 30 seconds is given to reverse the symptoms. Flamazanil is administered at 0.5 milligrams, 5 milliliters, IV for 30 seconds if the patient does not respond to the initial dose or if a reversal in sedation is not seen. Flamazanil is administered at 0.2 milligrams, 2 milliliters, IV for 15 seconds for the reversal of moderate sedation after general anesthesia. It can then be administered at 0.2 milligrams, 2 milliliters, IV for 60 seconds if the patient doesn't respond to the initial dose of 0.2, 2 milliliters, IV for 15 seconds. A patient is scheduled to have a brief surgical procedure. Which drug does the nurse expect to be used during surgery? 1. Thiopental. 2. Butabarbital. 3. Pentobarbital. 4. Phenobarbital. Answer. 1. Thiopental. Rationale. Thiopental is an ultra-short-acting drug that is used as anesthesia for short surgical procedures. Butabarbital is used as a sedative. Pentobarbital is used to control convulsive conditions. Phenobarbital is used for the prophylaxis of epileptic seizures. A patient of Hispanic origin who experiences insomnia visits the community nurse for counseling. The nurse educates the patient about self-care activities that may enhance sleep. Which statement indicates the need for additional teaching? 1. I will have a glass of warm milk before bed. 2. I should avoid exercise just before going to bed. 3. I may be prescribed benzodiazepines to promote sleep. 4. I will stop drinking coffee at least 6 hours before bedtime. Answer. 1. I will have a glass of warm milk before bed. Rationale. Hispanics, Asians, Pacific Islanders, and African Americans have a high incidence of lactose intolerance. Such patients should not be advised to drink warm milk at bedtime to enhance sleep. Consumption of milk may lead to gastrointestinal distress, abdominal cramping, and bloating. However, lactose-free milk may be used. Exercising just before going to bed may hamper sleep. The primary healthcare provider may prescribe a mild sedative if required. Coffee is a stimulant and its consumption must be stopped at least 6 hours before sleep. The barbiturate phenobarbital is prescribed for a patient with epilepsy. While assessing the patient's current medications, the nurse recognizes that interactions may occur with which drugs. Select all that apply. A. Antihistamines B. Opioids C. Diuretics D. Anticoagulants E. Oral contraceptives F. Insulin. Answer. A. Antihistamines B. Opioids D. Anticoagulants E. Oral contraceptives. Rationale. The co-administration of barbiturates and alcohol, antihistamines, benzodiazepines, opioids, and tranquilizers may result in additive CNS depression. Co-administration of anticoagulants and barbiturates can result in decreased anticoagulation response and possible clot formation. Co-administration of barbiturates and oral contraceptives can result in accelerated metabolism of the contraceptive drug and possible unintended pregnancy. There are no interactions with diuretics and insulin. The nurse is teaching a group of nursing students about the stages of non-rapid eye movement, non-REM, sleep. Which is the third stage of sleep? 1. Dozing 2. Relaxation 3. Deep sleep 4. Sleepwalking. Answer. 3. Deep sleep. Rationale. Deep sleep is the third stage of sleep. The person finds it difficult to wake, and the respiratory rate, pulse rate, and blood pressure may decrease. Dozing is the first stage of sleep. The person has feelings of drifting off to sleep. Relaxation is the second stage of sleep. The person can easily be awakened. In the fourth stage of sleep, it is very difficult to wake the person up, and sleepwalking may occur during this stage. Which condition contraindicates barbiturates? 1. Drug allergy 2. Cardiac disease 3. Epileptic disease 4. Narrow-angle glaucoma. Answer. 1. Drug allergy. Rationale. Barbiturates can be used as hypnotics, sedatives, and anticonvulsants and for anesthesia. This class of drugs is contraindicated in patients with known drug allergy, pregnancy, or severe kidney or liver disease. Valerian, Valeriana officinalis, is an herbal product that is contraindicated in patients with cardiac disease. Barbiturates are indicated for the treatment of epileptic disease because of their anticonvulsant properties. Narrow-angle glaucoma contraindicates benzodiazepines. The primary healthcare provider has prescribed rifampin for tuberculosis and a benzodiazepine to induce sleep in a patient. What report may the nurse expect from this patient during a follow-up visit? 1. I sleep less than I used to. 2. I feel like I breathe too deeply. 3. Nowadays I sleep for long hours. 4. I often feel dizzy and lightheaded. Answer. 1. I sleep less than I used to. Rationale. Use of rifampin increases the metabolism of benzodiazepine. This would reduce the effect of benzodiazepine, so the patient would have less sleep than normal. The patient may have low blood pressure or respiratory depression if using central nervous system depressants. The use of antifungal medications such as azole would reduce the benzodiazepine metabolism. Consequently, the patient would sleep longer than expected. The nurse is preparing to administer a barbiturate. Which conditions or disorders would be a contraindication to the use of these drugs? Select all that apply. A. Gout. B. Pregnancy. C. Epilepsy. D. Severe chronic obstructive pulmonary disease. E. Severe liver disease. F. Diabetes mellitus. Answer. B. Pregnancy. D. Severe chronic obstructive pulmonary disease. E. Severe liver disease. Rationale. Contraindications to barbiturates include pregnancy, significant respiratory difficulties, and severe liver disease. In addition, co-administration of barbiturates with alcohol, opioids, benzodiazepines, and some other drug groups can result in additive central nervous system (CNS) depression. A patient has experienced insomnia for months, and the physician has prescribed a medication to help with this problem. The nurse expects which drug to be used for long-term treatment of insomnia? A. Secobarbital, Seconal, a barbiturate. B. Diazepam, Valium, a benzodiazepine. C. Midazolam, Versed, a benzodiazepine. D. Esopiclone, Lunesta, a non-benzodiazepine sleep aid. Answer. D. Esopiclone, Lunesta, a non-benzodiazepine sleep aid. Rationale. Esopiclone, Lunesta, is one of the newest prescription hypnotics to be approved for long-term use in treatment of insomnia. Barbiturates and benzodiazepines are not appropriate for long-term treatment of insomnia. Midazolam is used for procedural, moderate sedation. The nurse notes in the patient's medication history that the patient is taking cyclobenzaprine, Flexeril. Based on this finding, the nurse interprets that the patient has which disorder? A. A musculoskeletal injury. B. Insomnia. C. Epilepsy. D. Agitation. Answer. A. A musculoskeletal injury. Rationale. Cyclobenzaprine, Flexeril, is the muscle relaxant most commonly used to reduce spasms following musculoskeletal injuries. It is not appropriate for insomnia, epilepsy, or agitation. Ramelteon, Rosarum, is prescribed for a patient with insomnia. The nurse checks the patient's medical history, knowing that this medication is contraindicated in which disorder? A. Coronary artery disease. B. Renal insufficiency. C. Liver disease. D. Anemia. Answer: C. Liver disease. Rationale: Ramelteon is contraindicated in cases of severe liver dysfunction. The other conditions are not contraindications. When teaching a patient about Temazepam, the nurse advises the patient to take it 1 hour before going to bed. Why does the nurse give this advice to the patient? 1. Temazepam may cause gastrointestinal upset. 2. Temazepam causes early awakening after sleep. 3. Temazepam induces sleep in approximately 1 hour. 4. The therapeutic activity of temazepam is reduced with sleep. Answer: 3. Temazepam induces sleep in approximately 1 hour. Rationale: the onset of action of temazepam is 1 hour. Thus, the nurse should advise the patient to take the medication 1 hour before going to bed. Gastrointestinal upset is a side effect associated with benzodiazepine drugs. This effect may not be prevented by taking the drug 1 hour before bed. The drug is known to prevent early morning awakening. Drug activity is not affected if the patient sleeps immediately. However, the patient will not be able to sleep immediately after taking the drug, because the drug requires some time to show its effect. Which benzodiazepine has rapid onset, is short-acting, relieves anxiety, and provides sedation before and during procedures? 1. Diazepam. 2. Midazolam. 3. Flurazepam. 4. Temazepam. Answer: 2. Midazolam. Rationale: Midazolam is used during the preoperative period to relieve anxiety, provide sedation, and help induce general anesthesia. Its rapid onset and brief duration of action provide the nurse with a higher degree of control over the effects of the drug. Diazepam is an old benzodiazepine used to relieve anxiety, induce muscle relaxation, and control seizure activity. Flurazepam, temazepam, and other older benzodiazepines are indicated for insomnia. These have been supplanted by newer drugs. While teaching about a medication regimen, the nurse advises the patient to take the medication no later than midnight and at least 4 hours before the patient usually awakens. Which drug has been prescribed to the patient? 1. Zaloplan. 2. Zolpidem. 3. Diazepam. 4. Midazolam. Answer: 1. Zaloplan. Rationale: Zaloplan is a commonly prescribed drug for patients who have trouble with waking up early. This drug is to be taken in the night at least 4 hours before the patient plans to wake up. Zolpidem is a long-acting hypnotic that can induce sleep for a prolonged period. Diazepam has many indications like muscle relaxation, pre-procedural sedation, status epilepticus, acute anxiety, and agitation. Midazolam is used to produce preoperative sedation. A patient with epilepsy is prescribed barbiturates. On further assessment, the nurse finds that the patient has depression. What classes of antidepressants does the nurse expect the primary healthcare provider to avoid when prescribing to this patient? Select all that apply. 1. Tricyclic antidepressant. 2. Monoamine oxidase inhibitor, MAOI. 3. Selective serotonin reuptake inhibitor, SSRI. 4. Reversible monoamine oxidase inhibitor, RMAOI, 5. Serotonin and noradrenaline reuptake inhibitor, SNRI. Answer. 1. Tricyclic antidepressant. 2. Monoamine oxidase inhibitor, MAOI, 4. Reversible monoamine oxidase inhibitor, RMAOI. Rationale. Tricyclic antidepressants, MAOIs, and RMAOIs interact with barbiturates. These drugs increase the activity of barbiturates and may lead to severe central nervous system depression. SSRIs and SNRI are not contraindicated with barbiturates because they do not prolong the effects of barbiturates. A patient is brought to the emergency department for treatment of a suspected overdose. The patient was found with an empty prescription bottle of a barbiturate by his bedside. He is lethargic and barely breathing. The nurse would expect which immediate intervention? A. Starting an intravenous infusion of diluted bicarbonate solution. B. Administering medications to increase blood pressure. C. Implementing measures to maintain the airway and support respirations. D. Administrating naloxone, Narcan, as an antagonist. Answer. C. Implementing measures to maintain the airway and support respirations. Rationale. There are no antagonists, antidotes for barbiturates. Treatment supports respirations and maintains the airway. The other interventions are not appropriate. A patient is taking flurazepam, Dalmane, 3 to 4 nights a week for sleeplessness. She is concerned that she cannot get to sleep without taking the medication. What non-pharmacologic measures should the nurse suggest to promote sleep for this patient? A. Providing a quiet environment. B. Exercising before bedtime to become tired. C. Consuming heavy meals in the evening to promote sleepiness. D. Drinking hot tea or coffee just before bedtime. Answer. A. Providing a quiet environment. Rationale. Non-pharmacologic approaches to induce sleep include providing a quiet environment, avoiding heavy exercise before bedtime, avoiding heavy meals late in the evening, and drinking warm decaffeinated drinks, such as warm milk, before bedtime. A patient is recovering from a minor automobile accident that occurred 1 week ago. He is taking cyclobenzaprine, Flexeril, for muscular pain and goes to physical therapy 3 times a week. Which nursing diagnosis would be appropriate for him? A. Risk for injury related to decreased sensorium. B. Risk for addiction related to psychologic dependency. C. Decreased fluid volume related to potential adverse effects. D. Disturbed sleep pattern related to the drug's interference with REM sleep. Answer. A. Risk for injury related to decreased sensorium. Rationale. Musculoskeletal relaxants have a depressant effect on the CNS, thus, the patient needs to be taught the importance of taking measures to minimize self-injury and falls related to decreased sensorium. Risk for addiction is not a NANDA nursing diagnosis. The other nursing diagnoses are not appropriate for this situation. A patient has been taking Temazepam, Restoril, for intermittent insomnia. She calls the nurse to say that when she takes it, she sleeps well. But the next day she feels so tired. Which explanation by the nurse is correct? A. Long-term use of this drug results in a sedative effect. B. If you take the drug every night, this hangover effect will be reduced. C. These drugs affect the sleep cycle, resulting in daytime sleepiness. D. These drugs increase the activity of the central nervous system, making you tired the next day. Answer. C. These drugs affect the sleep cycle, resulting in daytime sleepiness. Rationale. Benzodiazepines suppress REM sleep to a degree, although not as much as barbiturates, and, thus, result in daytime sleepiness, a hangover effect. The other statements are incorrect. A 50-year-old man who has been taking phenobarbital for 1 week is found very lethargic and unable to walk after eating out for dinner. His wife states that he has no other prescriptions and that he did not take an overdose. The correct number of pills is in the bottle. The nurse suspects that which of these may have happened. A. He took a multivitamin. B. He drank a glass of wine. C. He took a dose of aspirin. D. He developed an allergy to the drug. Answer. B. He drank a glass of wine. Rationale. Alcohol has an additive effect when combined with barbiturates and causes central nervous system, CNS depression. Multivitamins and aspirin do not interact with barbiturates, and this situation does not illustrate an allergic reaction. A patient has been taking phenobarbital for 2 weeks as part of his therapy for epilepsy. He tells the nurse that he feels tense and that the least little thing bothers him now. Which is the correct explanation for this problem? A. These are adverse effects that usually subside after a few weeks. B. The drug must be stopped immediately because of possible adverse effects. C. This drug causes the rapid eye movement, REM, sleep period to increase, resulting in nightmares and restlessness. D. This drug causes deprivation of REM sleep and may cause the inability to deal with normal stress. Answer. D. This drug causes deprivation of REM sleep and may cause the inability to deal with normal stress. Rationale. Barbiturates such as phenobarbital deprive people of REM sleep, which can result in agitation and the inability to deal with normal stress. A rebound phenomenon occurs when the drug is stopped, not during therapy, and the proportion of REM sleep increases, sometimes resulting in nightmares. The other options are incorrect. A patient who has received some traumatic news is panicking and asks for some medication to help settle down. The nurse anticipates giving which drug that is most appropriate for this situation. A. Diazepam, Valium. B. Zolpidem, Ambien. C. Phenobarbital. D. Cyclobenzaprine, Flexeril. Answer. A. Diazepam, Valium. Rationale. Benzodiazepines such as diazepam are used as anxiolytics, or sedatives. Zolpidem is used as a hypnotic for sleep. Phenobarbital is not used as an anxiolytic but is used for seizure control. Cyclobenzaprine as a muscle relaxant and is not used to reduce anxiety. Which of the following natural health products are used by some people to promote sleep and to relieve anxiety and restlessness? A. Kava. B. Garlic. C. Ginger. D. Ginkgo. Answer. A. Kava. Rationale. Kava may be used to promote sleep and for relief of anxiety and restlessness. One of the potential disadvantages of chloral hydrate, chlorinum, is that tachyphylaxis may develop. Which of the following describes tachyphylaxis? A. Rapid heart rate. B. Rapid respiration rate. C. A rapid decrease in response to the drug after repeated doses. D. A drug's ability to reach the therapeutic index level more rapidly than other drugs. Answer. C. A rapid decrease in response to the drug after repeated doses. Rationale. Tachyphylaxis is the rapid appearance of a progressive decrease in response to a drug after its repetitive administration. This effect makes chloral hydrate, chlorinum, useful for short-term therapy only. A 45-year-old female has been taking dantrolene, Dantrium, as part of the treatment for multiple sclerosis. Which of the following laboratory values should the nurse monitor while the patient receives dantrolene? A. Creatinine. B. Sedimentation rate. C. Liver function studies. D. Hemoglobin and hematocrit. Answer. C. Liver function studies. Rationale. Dantrolene can cause liver damage. Liver function studies should be performed during therapy. Why are muscle relaxants prescribed for patients with Huntington disease? 1. To relieve nerve pain. 2. To reduce muscle rigidity. 3. To prevent lightheadedness. 4. To reduce chloroform movement. Answer. 4. To reduce chloroform movement. Rationale. Muscle relaxants are prescribed for patients with Huntington disease to reduce chloroform movement. These drugs are more effective when used in combination with physical therapy. Muscle relaxants are primarily used for relief from painful musculoskeletal conditions but are also used to relieve the pain associated with trigeminal neuralgia or nerve pain. Muscle relaxants are used to reduce muscular rigidity in patients with Parkinson's disease. Lightheadedness is an adverse effect of muscle relaxants. Which is the most important nursing intervention while caring for a teenage patient who is on benzodiazepine therapy? 1. Monitoring for suicidal tendencies. 2. Encouraging the patient to drink more fluids. 3. Assessing the patient's risk for injury or falls. 4. Monitoring the patient's renal and hepatic function. Answer. 1. Monitoring for suicidal tendencies. Rationale. Because of the prolonged effects of benzodiazepines on the central nervous system, CNS, the patient may develop suicidal tendencies. Therefore, the nurse should closely monitor the teenage patient for this. Older adults may have an increased risk of falling because of excessive drowsiness. The nurse should assess the risk for injury or falls if the patient is elderly. The nurse encourages the patient to increase the intake of fluids for complete excretion of the drug from the body, which helps to reduce its adverse effects, but this is not the most important intervention. The nurse should monitor renal and hepatic function to prevent potential toxicity or complications resulting from decreased excretion or metabolism, but monitoring for suicidal tendencies is the priority. The primary healthcare provider has asked the nurse to administer diazepam to a patient who has symptoms of alcohol withdrawal. Why does the primary healthcare provider select this drug for the patient? 1. The patient may need to be sedated to relieve symptoms of alcohol withdrawal. 2. The drug acts on benzodiazepine receptors that play a role in alcohol addiction. 3. The drug may reduce the memory of painful symptoms related to alcohol withdrawal. 4. The drug acts on gamma-aminobutyric acid, GABA, receptors in the central nervous system, CNS. Answer. 2. The drug acts on benzodiazepine receptors that play a role in alcohol addiction rationale. Because the receptors for benzodiazepines and alcohol addiction are present in the same area in the CNS, some benzodiazepines such as diazepam and chlordiazepoxide are used for alcohol withdrawal. Sedation is not required for a patient who has symptoms of alcohol withdrawal. Benzodiazepines are combined with anesthetics, analgesics, and neuromuscular blocking agents for their amnesic properties, but this does not help in treating alcohol withdrawal. Benzodiazepines produce sedation by acting on GABA receptors, but this does not reduce the symptoms of alcohol withdrawal. A patient is taking flurazepam, apoflurazepam, 3 to 4 nights a week for sleeplessness. She is concerned that she cannot get to sleep without taking the medication. What measures are appropriate for this patient? A. Trying to establish set sleep patterns. B. Exercising before bedtime to become tired. C. Consuming heavy meals in the evening to promote sleepiness. D. Drinking warm beverages, such as tea or coffee, just before bedtime. Answer. A. Trying to establish set sleep patterns rationale. Non-pharmacological approaches to induce sleep include establishing set sleep patterns. The patient should avoid heavy exercise before bedtime, avoid heavy meals late in the evening, and should drink warm decaffeinated drinks, such as warm milk, before bedtime. Which of the following is a true statement about sedatives and hypnotics? A. The two terms mean the same thing. B. A hypnotic causes sleep. C. Low doses of sedatives will cause sleep. D. Compare with sedatives, hypnotics have a less potent effect on the central nervous system. Answer. B. A hypnotic causes sleep. Rationale. A sedative reduces nervousness, excitability, and irritability without causing sleep, whereas a hypnotic causes sleep. A patient asks the nurse about a new drug advertised on television. The patient wants to know if Ambien would be better for her to use than her current medication, Restoril, for periodic insomnia. The nurse's response is based on knowledge that Zolpidem, Ambien, Sedatives is less likely to cause grogginess in the morning. B. Is a pregnancy category C medication. C. Is contraindicated with asthma. D. Should be limited to 7 to 10 days of treatment. E. Drug class, benzodiazepine. Answer. A. Is less likely to cause grogginess in the morning. B. Is a pregnancy category C medication. D. Should be limited to 7 to 10 days of treatment. Midazolam, versed, has been ordered for a patient to be administered by injection 30 minutes prior to a colonoscopy. The nurse informs the patient that one of the most common side effects of this medication is which effect? A. Decreased heart rate. B. Amnesia. C. Constipation. D. Dry mouth. Answer. B. Amnesia rationale. Versed is known to cause amnesia and anxiolysis as well as sedation and is therefore commonly used prior to certain procedures. The patient's chart notes the administration of dantrolene, Dantrium, immediately postoperatively. What does the nurse expect the patient has experienced? A. Delirium tremens. B. Malignant hyperthermia. C. Tonic-clonic seizure. D. Respiratory arrest. Answer. B. Malignant hyperthermia. Rationale. Dantrolene is a direct-acting musculoskeletal muscle relaxant and is the drug of choice to treat malignant hyperthermia, a complication of generalized anesthesia. During patient teaching, the nurse explains the difference between a sedative and hypnotic with which statement? A. Sedatives are much stronger than hypnotic drugs and should only be used for short periods of time. B. Sedative drugs induce sleep, whereas hypnotic drugs induce a state of hypnosis. C. Most drugs produce sedation at low doses and sleep, the hypnotic effect, at higher doses. D. There really is no difference. The terms are used interchangeably. Answer. C. Most drugs produce sedation at low doses and sleep, the hypnotic effect, at higher doses. Rationale. Many drugs have both sedative and hypnotic properties, with the sedative properties evident at low doses and the hypnotic properties demonstrated at larger doses. Which is a side effect of the non-benzodiazepine drug Zolpidem? 1. Bedwetting. 2. Sleepwalking. 3. Increased perspiration. 4. Increased body weight. Answer. 2. Sleepwalking. Rationale. Benzodiazepines induce daytime sleeping in a few cases. To reduce the daytime sleep, these patients may be prescribed Zolpidem, which is a non-benzodiazepine drug. This drug is known to cause sleepwalking, somnambulation, as a side effect. Bedwetting is more related to neurologic problems and is not an effect of non-benzodiazepines. Perspiration and body weight are not affected by non-benzodiazepine therapy. A patient who has difficulty sleeping has been prescribed diazepam. On the follow-up assessment, the nurse finds that the patient has prolonged sleep. What assessment finding is the reason for the prolonged sleep? 1. The patient takes rifampin along with diazepam. 2. The patient takes olanzapine along with diazepam. 3. The patient takes phenobarbital along with diazepam. 4. The patient takes grapefruit juice along with diazepam. Answer. 4. The patient takes grapefruit juice along with diazepam. Rationale. Intake of grapefruit juice decreases the metabolism of diazepam by inhibiting the cytochrome P450 system, which causes prolonged sleep. Rifampin increases the metabolism of diazepam and may not result in prolonged sleep. Olanzapine increases the effects of diazepam but may not affect sleep. Phenobarbital has an additive effect with diazepam and increases the central nervous system depression. It does not have any significant effect on sleep. While monitoring a patient who has been administered pentobarbital, the nurse finds that the patient is developing signs of barbiturate toxicity. What conditions does the nurse observe in the patient? Select all that apply. 1. Frequent coughing. 2. Peripheral cyanosis. 3. Increased blood pressure. 4. Cheyne-Stokes respirations. 5. Increased body temperature. Answer. 1. Frequent coughing. 2. Peripheral cyanosis. 4. Cheyne-Stokes respirations rationale. Barbiturate overdose causes respiratory depression. This may lead to signs such as coughing and Cheyne-Stokes respirations. As the respiratory center is depressed, the oxygenation of the blood is also reduced. This causes cyanosis, which is manifested as a bluish discoloration of the extremities. Barbiturates are central nervous system depressant medications, and thus an overdose would cause decreased body temperature and decreased blood pressure. The nurse notes that a patient has taken an excessive dose of baclofen. Which action does the nurse implement immediately? 1. Comfort measures. 2. Seizure precautions. 3. Airway maintenance. 4. Antidote preparation. Answer. 3. Airway maintenance rationale. An overdose of baclofen can cause respiratory depression as a result of excessive central nervous system depression. So the nurse has to maintain an open airway with the use of oxygen and a bag for ventilation. General supportive therapy and seizure therapy, including cardiac monitoring, gastric lavage, and fluid therapy, are then instituted to maintain vital functions until the depressant effects of baclofen wear off. Although comfort measures are usually appropriate, the nurse's priority is the maintenance of vital functions. An antidote to baclofen does not exist. Which drug is contraindicated in patients with chronic obstructive pulmonary disease, COPD? 1. Zolpidem. 2. Diazepam. 3. Ramelteon. 4. Pentobarbital. Answer. 3. Ramelteon rationale. Ramelteon is recommended for the treatment of insomnia. This drug is contraindicated for patients with COPD or sleep apnea. Zolpidem is a non-benzodiazepine drug used for the treatment of insomnia. It is contraindicated in patients with drug allergy, glaucoma, or pregnancy. Diazepam is a benzodiazepine drug used for the treatment of sleep disorders. It is contraindicated in patients with drug allergy, glaucoma, or pregnancy. Pentobarbital is a barbiturate class of drug used as hypnotic, sedative, and anticonvulsant. It is contraindicated in patients with drug allergy, pregnancy, or severe kidney or liver disease. A patient with multiple sclerosis participates in a rehabilitation program. The patient takes baclofen to help manage muscle spasticity. How will the baclofen interfere with the patient's rehabilitation activities? 1. By causing gastrointestinal distress. 2. By impairing coordinated movements. 3. By increasing pain associated with activities. 4. By producing drowsiness, lethargy, and blurred vision. Answer. 4. By producing drowsiness, lethargy, and blurred vision rationale. Baclofen falls under the barbiturates category, and drowsiness, lethargy, and blurred vision are adverse effects of baclofen, which will make it difficult for this patient to participate actively in rehabilitation activities. Gastrointestinal distress is one of the adverse effects of niacin, which is an antilipemic drug. Another adverse effect of antilipemic drugs is increased muscle pain associated with activity. Impaired physical mobility is an adverse effect related to antiemetic and anti-nausea drugs. A patient is admitted to the hospital in an unconscious state caused by an overdose of benzodiazepines. The nurse administers flumazenil, and the patient regains consciousness but becomes unconscious again after some time. What is the reason for the patient becoming unconscious again? 1. The half-life of flamazanil is short. 2. A high dose of flamazanil was given. 3. Alcohol was consumed with the benzodiazepines. 4. 0.2 milligrams, 2 milliliters, of flamazanil was given intravenously, IV. Answer. 1. The half-life of flamazanil is short. Rationale. Flamazanil has a short half-life and its duration of effect is 1 to 4 hours. Therefore, the dose of the reversal drug may wear off and the patient may become unconscious again. Administration of flamazanil in higher doses is required for recovery when the patient becomes unconscious again. Consuming alcohol along with benzodiazepines results in hypotension and respiratory depression. Administration of 0.2 milligrams, 2 milliliters, of flamazanil IV over 15 seconds is required for reversal of moderate sedation or general anesthesia. A patient is admitted to the emergency department after taking an overdose of a barbiturate 15 minutes prior to arrival. The nurse can anticipate that which drug will be prescribed. A. Naloxone, Narcan, B. Activated charcoal, C. Flamazanil, Romazycon, D. Ipecac syrup. Answer. B. Activated charcoal. Rationale. There is no antidote for barbiturates. The use of activated charcoal absorbs any drug in the gastrointestinal tract, preventing absorption. A nurse would monitor older adults who are prescribed a benzodiazepine for treatment of insomnia, for which potential side effect: A. Hallucinations, B. Ataxia, C. Alertness, D. Dyspnea. Answer. B. Ataxia. Rationale. Benzodiazepine doses for children and the elderly should be small with gradual increases to avoid ataxia and excessive sedation. Thus, these patients should be closely monitored for these adverse effects. A hospitalized patient is complaining of having difficulty sleeping. Which action will the nurse take first to address the problem? A. Administer a sedative-hypnotic drug if ordered. B. Offer tea made with the herbal preparation valerian. C. Encourage the patient to exercise by walking up and down the halls a few times if tolerated. D. Provide an environment that is restful and reduce loud noises. Answer. D. Provide an environment that is restful and reduce loud noises. Which considerations are important for the nurse to remember when administering a benzodiazepine as a sedative-hypnotic drug? SEDA. A. These drugs are intended for long-term management of insomnia. B. These drugs can be administered safely with other CNS depressants for insomnia. C. The dose needs to be given about 1 hour before the patient's bedtime. D. The drug is used as a first choice for treatment of sleepiness. E. The patient needs to be evaluated for the drowsiness that may occur the morning after benzodiazepine is taken. Answer. C. The dose needs to be given about 1 hour before the patient's bedtime. E. The patient needs to be evaluated for the drowsiness that may occur the morning after benzodiazepine is taken. While assessing a patient who has been administered midazolam, the nurse finds that the patient's blood pressure is very low. Which prescription will the nurse discuss with the primary healthcare provider? 1. Flamazanil at a maximum dose of 1 mg. 2. Flumazenil at a maximum dose of 3 mg 3. Phenylephrine at a maximum dose of 2 mg 4. Phenylephrine at a maximum dose of 5 mg. Answer. 2. Flumazenil at a maximum dose of 3 mg midazolam as a benzodiazepine. Hypotension as a sign of severe benzodiazepine toxicity. A patient experiencing benzodiazepine toxicity should be given flumazenil at a maximum dose of 3 mg, which acts as an antidote. Flumazenil at maximum dose of 1 mg is given when moderate toxicity is seen. Moderate toxicity causes symptoms such as confusion and drowsiness but not hypotension. Phenylephrine is administered to correct hypotension but is not used as an antidote for benzodiazepine. The nurse will monitor the patient who is taking a muscle relaxant for which adverse effect: A. CNS depression, B. Hypertension, C. Peripheral edema, D. Blurred vision. Answer. A. CNS depression. The nurse is preparing to administer a medication for sleep. Which intervention applies to the administration of a non-benzodiazepine, such as Zolpidem, Snyder? A. These drugs need to be taken 1 hour before bedtime. B. Because of their rapid onset, these drugs need to be taken just before bedtime. C. The patient needs to be cautioned about the high incidence of morning drowsiness that may occur after taking these drugs. D. These drugs are less likely to interact with alcohol. Answer. B. Because of their rapid onset, these drugs need to be taken just before bedtime. Rationale. The prescribed drug for the patient is a non-benzodiazepine such as Zolpidem, which functions rapidly after administration. Hence, the most appropriate intervention would be to administer the drug just before bedtime. Drugs such as Zolpidem function rapidly and the duration of effect depends on the dosage. Hence, proper dosage while inducing rapid results need not necessarily cause drowsiness the next morning. The given example presents a patient who is under nursing care and drug interactions with alcohol need not be the priority intervention before the patient is administered with drugs to induce sleep. An older adult has been given a benzodiazepine for sleep induction, but the night nurse noted that the patient was awake most of the night, watching TV and reading in bed. The nurse documents that the patient has had which type of reaction to the medication? A. Allergic, B. teratogenic, C. Paradoxical, D. Idiopathic. Answer. C. Paradoxical. Rationale. The most appropriate description for the ineffectiveness of the drug for the patient presented in the example will be paradoxical. The given example presents a patient on whom the drug benzodiazepine had no effect. The drug is normally administered during the night to induce sleep. Such unresponsiveness is not similar to allergic reaction to the drug. Teratogens are those drugs that cause birth defects when administered to pregnant women. The non-responsiveness of the patient in the given example for the drug benzodiazepine is not termed as a teratogenic effect. The term idiopathic refers to a spontaneously occurring clinical condition and is not used to describe the loss of effect of a drug. A patient has been admitted to the ER because of an overdose of an oral benzodiazepine. He is very drowsy but still responsive. The nurse will prepare for which immediate intervention? A. Hemodialysis to remove the medication. B. Administration of flumazenil. C. Administration of naloxone. D. Intubation and mechanical ventilation. Answer: B. Administration of flumazenil. Rationale: the most appropriate immediate nursing intervention for a patient with overdose of the drug benzodiazepine is to administer a reversal drug. An appropriate reversal drug is flumazenil. This drug is a psychoactive drug and has therapeutic uses in certain mental illness disorders. The patient is responsive although drowsy, and as this drug cannot be removed from the system through hemodialysis, the best immediate nursing intervention for the patient is to administer a reversal agent. Naloxone is not a choice drug for the reversal of effects induced by benzodiazepine. Intubation and mechanical ventilation are not required as an immediate appropriate nursing intervention.